Now, the federal government says it is currently working on the type of vaccine to procure and the quantity needed. It has allocated 5.84 billion naira in the 2021 budget to key agencies concerned with pharmaceutical and vaccines development. A first shipment of the vaccine is expected to arrive at the end of this month. Among the first set of people to be vaccinated are health workers in isolation centers nationwide, 10% of adults above 50 years among other risk groups. Also, states with a high burden of infection will be given priority. Now joining us is the Head of Operations, Irede Foundation, Wurola Kayode, as well as CEO, Health Emergency Initiative, Pascal Achinini. Thank you for joining us.
Thank you.
Good morning.
Thank you for having me.
Good morning.
Now, let's begin this way. The 5.84 billion naira being put together by the government to budgets to agencies, for agencies to perhaps research and develop vaccines along the line to address this pandemic. I wonder if this is a step in the right direction in the first place. Let me begin with you.
Absolutely. Everybody knows that we have to begin to take steps to confront this, and the government is taking the first step to buy 100,000. Of course, that 100,000 means that there will only be 50,000 people because the vaccine is designed in such a way that after a pair goes for one person.
Right.
But it's also a bit intriguing because we expected that with the build-up to the vaccine production and distribution, that by today is already 14th of January, we should be talking about more quantity. So the provision is for the Pfizer vaccine. What we also want to be clear is whether the storage and other infrastructure required, because it's meant to be stored in -70 or thereabout temperature.
Yeah.
So whether we have put in place enough resources to ensure that we achieve that. But 100,000, and from the feedback we got from the National Primary Healthcare Agency yesterday, it suggests that more quantity can only come in the second quarter, and this is just 100,000. So we commend the government for at least acknowledging that there's a need to get the vaccine, but that quantity and the resources deployed so far, and efforts being put in towards that so far, I feel that more needs to be done. More absolutely need to be done.
All right, let's get your perspective to this issue now, Wurola.
I'd like to leverage on, as a concerned persons living with disability.
Right.
Say last year we had a brief survey collecting information from persons living with disability on how COVID affected them during the lockdown and even during it. And we figured that they were left behind in the sense of the palliative support provided for them, left in the sense of provisions available for persons living with disability. Now, coming back to this vaccine, the question is, are people living with disability put into this? Are the considerations made available for them? Yes, we have the number, and let us also remember that 15% of the population of persons living in Nigeria are persons living with disability. Are we putting them into this conversation? Are we putting them into this strategic plan with regards to the vaccine?
But how are they, people like your organization, what is the level of engagement with government to ensure that, you know, this cross-section of the society is paid attention is given to them? I mean, during the first lockdown, what conversations were you having with the government at different levels? What exactly was happening such that they will be put into consideration? Okay,
so Irede Foundation is under an association, that's JUNAPE, that's the Joint Association for the Joint National Association for Persons Living with Disability.
Right.
And what that organization went on behalf of every cluster of persons, of organizations working with disability, on speaking on behalf of them. Now, one of the things they did was go in to say, okay, with regards to the COVID palliative, they went in, giving them the statistic number to say, these are the persons we have living with disability across clusters, make provisions for them. And may I also call our attention to it that this happened as an afterthought. It didn't happen during the strategic planning of everything that happened. It happened all because they came in to make their concerns, not because we needed to make that provisions even before they came asking for it. So Jonaped is standing in, speaking on behalf of organizations and persons living with disabilities to say we want inclusion, we don't want to be left behind.
And what was the response, still staying with you now, what was the response they got at the time from government such that they could build on moving forward?
So yes, they got the response, but then it still met about less than 50% of the entire population.
Right.
So in the sense that, and I will still make reference to this palliative because I mean, persons living with disability don't really have there's set of limitations that's happening around them. So from economic empowerment, these are people who are still trying to catch up with their livelihood. Then it was cut short during the lockdown, and they went say, okay, you know what, make provisions for our people. But 50%, even less than 50% of persons living with disability were provided for. The logistics, even sending the palliative support to them across, was quite ill, where they had to now literally make these provisions for themselves. So the response was not as expected. It wasn't the way they wanted it to happen.
So from what you're saying now that the government is looking at, vaccines, we should be, when it gets to Nigeria, they should be part of those that should be considered first.
Exactly.
All right, let's come back to you now, Pascal Achilini, and still talking about our capacity. You would recall that an expert recently said that Nigeria does not have the capacity when it comes to developing vaccines because over time we had not made investments over the years. You would recall that in the 70s, in the 80s, we developed vaccines, but afterwards, nothing has been done. And now these monies that the government is, budgeting, how much of a difference would it make to ensure that we achieve what we really are looking forward to?
We would look at it from the standpoint of the emergency we have. The emergency is that we get the vaccine that has been clinically tested. Government is talking, besides the Pfizer, government is also weighing the options of Moderna and the Oxford vaccine, and also reaching out to China, to
Russia as well.
Russia also to bring them in, and that's why it's weighing the options. And the context of developing capacity, indigenous capacity for development of vaccine, I think at this stage, if you go to Harvard, if you go to most of the other countries of the world, corporates, multinationals and local corporates intentionally commit part of their resources to fund vaccine. If we want to wait until a time when there will be budgetary allocation from state or federal government to do that, we may not achieve much mileage in the short run.
Really?
We could get that, we can grow that capacity, that level of governance, that level of a commitment to such important things in the future. But right now, if we have to make a difference vis-a-vis what is happening in other parts of the world, is for a trust fund, so to say, from the private sector, because it concerns all of us, to design something that will work. Government could be on board for governance issues, but funding, from the context of funding, the private sector and corporates should lead. But I want to also emphasize that I checked yesterday, some of the reports said Kenya is ordering for 20 million, Senegal is ordering for...
South Africa, about 100
About 100 million. And we are talking about 200 plus population. We are seeing 100,000, and we also saw the allocation is actually, curiously, the allocation is not reflecting the level of infection per state.
Yeah.
So one of the concerns some of us have had is this in the exclusive list? Is it only the federal government that is saddled with the responsibility of bringing this vaccine? Are states, subnationals like states that have capacity, able to engage COVAX?
There were also reports of certain states looking into perhaps purchasing this vaccine.
Yeah, absolutely, yes.
That would go a long way,
Yeah,
do you
because
think?
we have an emergency, and some of the reports from the government show that conversation is between various ministries in the next 1, 2, 3 weeks for them to identify what needs to be done and the resources before it goes to the National Assembly. I think that the best time for a legislation or a bill for that purpose to be, and in fact, an act of the parliament to be done is yesterday. Waiting and taking it as normal issues, this is an emergency. And it's actually first come, first serve.
So do you think that this is why perhaps persons are criticizing the approach to addressing the pandemic. They are looking at the gaps, pointing out certain gaps, like what you have mentioned.
Yeah, it's very shocking. And the thing is, I saw a number of communications in the last few days pointing to, of course, you cited a very important national figure who died yesterday,
Yes.
and the report said it was COVID-19. There have been many are still treating this as our usual approach to issues. This requires willpower. This requires the intentionality on the part of every stakeholder. And I always point to the private sector. There are elites. If you recall, at a time, one of the philanthropists in America mobilized other billionaires across the world to set up a trust fund. So
Yes.
the elites, the private sector, must work together, because perhaps the concern of the government, we are going through a recession. The concern of the government might probably be how to put the funds together. Why not we create a buffer? Okay, government, we can latch on this. This is what the private sector, together with the elites, have put together. We put in place monitoring and evaluation mechanisms to make sure that the funds are judiciously used and some transparency deployed.
We're not seeing that happen, and I'm wondering why. It's seemingly not. We are not seeing this conversation happening.
The shock is that people think that COVID-19 is something we treat with kid glove. If you are an elite, if you're a private sector person, you have 5 billion, 10 billion stuck somewhere, and somehow you go down on COVID-19, the person dies. All of that will make no meaning. So why not, make sure that the structure is transparent, but let's support and complement what the government is doing for purpose of, as they say, enlightened self-interest.
Very important. Now, let's come to you, Wuraola. What concerns do you have with regards to this issue? And you also have listened to what he has said. What concerns do you have that you think should be addressed, especially with regards to people living with disabilities?
Still goes back to engagement, putting them involved, getting them in conversations, bringing them into the room to speak for themselves, to speak for the need that they require, and basically using the feedback that they get to ensure all of this.
How
is
about
made a point.
data? Do we have that? Do you think the government is also trying to garner that to ensure that, this issue is addressed and none of them are left behind?
So JONAPED can answer that bit, but what I know is that direct conversation with JONAPED gives us that they don't have the data. They are even the ones providing the data to the government, saying based on collection from different organizations, different CSOs, these are the numbers we have. So you use this number. That's the information that we have for that bit.
All right, now, let's come back to the fact that government is working on the type, which is also something that has also generated conversations and controversies. You earlier mentioned if we have the storage facilities. We are not seeing or hearing much with regards to that aspect. What do you think that we are not getting right and perhaps should set on the ground before we bring in the vaccines, whichever type, at the end of the day?
I think issues around COVID-19 requires planning. It requires being deliberate and intentional.
And we're not doing that?
Because even if we get 100 million, maybe one nation says, okay, take 100 million vaccines to Nigeria out of kindness. We do not have a structure right now, from what has been communicated or what most of us know in the public space, that we don't have power infrastructure or that would ensure the right storage is maintained so that the potency is retained until it is administered. Because as you know, if you administer one today, you wait until 4 weeks before the next vaccine. There are 2 legs to it. Secondly, that's also why, as Health Emergency Initiative, one of the things we've actually put forward is one organization came to us and carried out a research and found out that our process of handling PPE was very credible. They brought multi-million naira worth of PPE and gave to us to ensure it got to the health workers. So social sector players, because I know the private sector most times, especially with COVID experience in palliatives, many may be very hesitant on putting funds down. But we have a common enemy. COVID-19 is an enemy to the public, private and social sector, and the ordinary citizen. So we need to close ranks. Identify such credible organizations. Besides HEI, there are others also who could do, where you ensure that this is what we are putting down, government. This an entity or an organization will say, I'm paying attention in supporting government or the collaboration, as she said, Urola said, in the area of power. These are temporary measures that will ensure that those vaccines' lives, shelf life are maintained. This is how we are going to ensure that those who would do what we did during polio, who administer the vaccines, this is how they will be incentivized or taken care of, their pay. And this is also what we do in enlightenment, because we must also deal with the issue here about conspiracy theories.
Yes.
People have said that several things about this, and yesterday I listened.
The myth and all
The
of
myth
that.
is that you must identify ways to show the public that this thing is real and people, the society connects with you. And also actions of government. We still see pictures of or reports that, no, this NIN registration continues. So people see that, they say, no, what's the need of social distancing when this government is also not budging here? So things that will make the public know that we have an emergency and it's critical and it can, is an existential threat. Let's all work together towards that.
And that is the fear a lot of persons have with regards to government's risk communication. On the one hand, you are talking about a rise in cases, yet you're asking people to go out to register. And from what we have seen, that is seemingly hampering the effectiveness of whatever measures the government is putting in place. What concerns do you have here?
Like I said yesterday to a friend, government is not showing, they're not leading, they're not showing the right example. You expect us to go with these precautions, social distance, but you're encouraging it through the registration of this NIN. So you see, just like I said, you see people say, you're telling me not to do this, you're telling us to reduce capacity in church and all, but you're not even showing it through this registration. So how am I supposed to take you serious? So government needs to show that we're serious about this, and it has to reflect in their own actions.
But do people know that their lives are also in their hands, beyond the government saying these things?
So let me come in here. One medical doctor made this suggestion that all the people who are doubting or this, whether this is real or not, and they are going in contravention with the protocols. When anyone is arrested or picked, whether at the nightclubs or otherwise, the punish community service for them is to go and handle the cylinders at the isolation centers or be part of those who will be no, they will use PPE and other things, but they will also be among those who will be moving the corpses to the mortuary. That it would make them know that this is real, because it's important to clarify that when we talk about vaccination, it's not a cure. It is also not going to get to over 80% of Nigerians until end of second quarter or thereabout. So between now and then, there are things we must do to stay alive. So as many...
So now, you just mentioned something that is of interest to me and a lot of persons. Because we have seen reports that said that persons took the vaccine, yet died or got infected. So what is the essence? That's a question that some persons have asked for the vaccination. If you say it is not really a cure,
yes.
So what is the essence of taking the vaccine?
So far, no vaccine has more than 95% potency. So the implication is that there could be, out of 100 people, there could be 5 who might die. It's worse not to have a solution at all. And this is still exploratory. There will still be a lot more improvement on the vaccine, because this just hit the world early last year and the vaccine came out too quick. So we expect that this is worse than not having something at all. But if you have access to the vaccine, take it. But most importantly, stay safe, because this vaccine is not a cure.
Prevention is better than cure, as it is often said. Well, let's thank you now, Head of Operations, the Irede Foundation, Wurola Kayode, as well as CEO, Health Emergency Initiative, Pascal Achunini. Thank you for your time on the program.
Thank you for having us.
It's my pleasure.